Let's talk about the simplified treatment strategy for rheumatoid arthritis. So, what is the first line? The first line drug, or the best drug, is methotrexate. That is the best drug. And what are the other drugs you can use instead of methotrexate? You can use leflunomide. Those are kind of like the second best option. And you may also use sulfasalazine and hydroxychloroquine alone or in combination with methotrexate, but those are lesser choices. So all of those are DMARDs, or disease-modifying antirheumatic drugs. And if those first-line drugs are unable to control the symptoms, you can also prescribe, along with the first-line drugs, you can also prescribe steroid at the first instance in a low dose, steroids and low dose, but they should not be continued for a long time because they have such severe effects. If methotrexate is unable to control symptom along with steroids at 3 to 6 months, then you have to go for the second-line agents. What are the second-line agents? You have anti-TNF agents, or you can use JAK2 inhibitors. What are the anti-TNF agents? Common ones: adalimumab, infliximab, and etanercept. And the JAK2 inhibitor is commonly known as tofacitinib. So you can continue those second-line biologics. So those are biologic drugs. Those are monoclonal antibodies or receptors. So those are the second-line DMARDs. Those are the second-line DMARDs. You can use them for another 3 to 6 months. And if the disease is controlled, very good. If the disease is still not controlled, you can switch to second-line biologics. And the second-line biologics are IL-6 inhibitors known as tocilizumab, IL-1 inhibitor known as anakinra, and CD20 blocker known as rituximab. There are many other drugs, but I have just summarized the most important or common ones used in the practice. So in summary, first line methotrexate, second line biologics such as anti-TNF and JAK2, and third line would be your IL-6, IL-1, and CD20 inhibitors.